I clearly remember I walked into the hospital as a just in case and came out as a mom because Ved came 18 days early and nothing went as planned. Hi guys, welcome to Mama Space with Manali. Thank you so much for clicking. If you're new here, I make videos about parenting, baby-led weaning, and everything mostly baby related. So in today's video, I'm going to share my entire experience about delivering in Germany, how to choose the right hospital. I'll also speak about birth preparation class and everything that you need to know which I didn't, which might help you in the whole pregnancy process. So first things first, selecting the hospital. Now this needs to be done at around 25 weeks or something. I mean, you will start searching for the hospital at this time, but you can register in the hospital anytime after 30 weeks. Now, I know selecting a hospital can really be overwhelming, so I'm going to give you a few tips and tricks and what are the parameters that I saw when I was selecting a hospital. So I don't know if you know, but in Germany, you can give birth at different places. You can give birth at the hospital, you can give birth in the birthing center, or even at your own home. Yes, that's possible, but I really did not want to opt for that one. So I went with the most common approach, that is opting for the hospital. Now, for the hospital opting, one thing which was very, very interesting is that every hospital hosts these open days. On the open days, they give you an overview about the facilities they have, how many midwives or nurses they have, how many patients can they handle. They even show you how the rooms are. And I would say this is very useful because when you look at the room, you get the feeling, you just have to match the vibe. You feel, okay, this seems to be a comfortable place. The second thing is what all are the pain management techniques that they have. You can also ask them that. For example, in the hospital that I selected, they had the normal painkiller, they had epidural, and they also had laughing gas. Laughing gas was something which the other hospitals did not provide as such, but honestly, I used it and I would totally recommend it. So I would say, if it's possible, then do opt for a hospital which at least has an option of laughing gas. Then the third parameter was, do they support breastfeeding? Do they have a lactation consultant? Do they have a special child unit, and I feel all these factors are really important because not all hospitals have a lactation consultant. So if you plan on breastfeeding, then it's important that the midwives there really help you towards that, because trust me, they say it comes naturally, but it doesn't come naturally. It's great when you have some support and someone to help. So apart from that, you can also speak to your friends or colleagues and ask them about their experience, and maybe that is also very useful. Another thing that you should also check is that do they speak English? Because I think as expats, that's extremely important that they speak English. I mean, the doctors generally speak English, but if the nurses can also speak English, it's a great add-on. Then the next point would be attending a birth preparation class. A birth preparation class is a class where they teach you or they prepare you about how the labor will go. And I mean, obviously, no one can really prepare you for how it is, but they tell you a lot of techniques which are really useful. For example, which position might help you relieve the pain a little bit, and they give you a lot of options. They also tell your husband how they can be helpful during this process. For example, they also told me that if in the water your contractions feel a little bit lighter, and they honestly did. So I would say there were a lot of good things. They also tell you about breathing practices, and I think this is another point which really helped me a lot during the labor and also helped me, I would say, dilate faster. So it was very, very helpful, the whole birth preparation class. This is something which is covered by your insurance, so you don't have to pay anything. But one thing is that you really need to look for these classes way in advance because they are generally booked, and especially if you want an English speaking class, and take this class in your 8th month, not too soon and of course not too late. You can find these classes online, or you can ask your hebame for them. I will also drop some links in the description below. So this was about the birth preparation classes. Now let's come to the third very interesting point, which was my delivery experience here in Germany. So this was around, I still clearly remember, 5:30 in the morning. One night before, we went out with friends, had Italian food, did some shopping, and everything was fine. Like, I just couldn't tell that the next day would change my life completely. So this was 5:30 in the morning, and I started feeling something like contractions. I was not sure that they are contractions because obviously this was the first time that I was pregnant, and I didn't know honestly what contractions felt like. I honestly thought they were just Braxton Hicks. But I started timing these contractions in an app, and they say that your contractions should last for 30 seconds and should be in a 2 minutes gap. And they were exactly like that. This is when I called the hospital and I asked them that I'm having contractions like these, should I already be on the way? And they told me there is nothing to worry. I can relax, but if I want to come, I should come and show it to them. I can wait a bit till the time the pain intensifies. Unfortunately, or how stupid of me, we had not really completely packed the hospital bag yet. I mean, it was lying open there. I had some stuff filled in, but I did not pack the bag. And we were like, okay, I think, this is like a wake-up call that we should pack our bags because the baby might come soon. So we were still taking it lightly. And, there were a few clothes that we had to put. So we even put the laundry thinking, oh, we're going to come back in an hour or two. And we went to the hospital at around 9:30. When we reached the hospital, as usual, there was a lot of paperwork to be done. This is also another tip. As soon as you're filling the form when you reach the hospital, you need to tell them right there that you would want a family room. They made us wait for a little bit, and then the nurse came to check if I was, how is the situation. She checked and she said, "Das Baby kommt heute," which means the baby's coming today. And I completely freaked out. Because my mom was supposed to come after 2 days, and we thought that my mom was anyway coming early because the baby had to come 18 days later. It was so soon, and there were no symptoms, nothing at all. So we completely freaked out. I called up my mom. I was crying. I was like, how am I going to do it? And she told me, no, you can do it. It's fine. You are strong. And she motivated me in every manner, and I love you, Mom, for this. But yeah, so it took some time to absorb the news that it's gonna happen today. Now, of course, let me fast forward it a little bit. They gave me the lunch, and then the pain intensified and blah blah blah. So I don't want to make the video very long, so I'm gonna skip what happened in those 5-6 hours. Then at around 5 or something, it was extreme. I had a lot of pain, and there was a point that I was about to also give up. I asked the hebame of what pain management options they have, and should I go for an epidural. But then I told myself, if it doesn't happen in the next half an hour, or if I cannot bear it anymore, I'm gonna go in and take the epidural. But during all this time, I was taking deep breaths. I also got a room with a bathtub, so I was trying to relax in the bathtub a little bit, on the birthing ball, and tried every possible things that I was taught in the birth preparation class. So I really used the knowledge practically. And then finally at around 7 o'clock, the hebame came and she said, "You are doing great, and you're almost there. You're already 9 centimeter dilated." So it was like, finally, what? I didn't imagine that it would happen. It really happened quickly, because at around 5 o'clock, I was just 6 centimeters dilated. So at around 7, they said we can move to the labor room. And another interesting fact is that here in Germany, during the whole process of your labor pains and everything, the doctor isn't there, the nurse is there. They give you your own time. They do not rush you up or hurry up. I mean, they cannot, but they are very, very cooperative. And they were like, there were nurses coming and telling me, you are doing a wonderful job, you just have to stay calm and breathe. And I would say the whole atmosphere was very relaxing that ways. I wasn't relaxing, I was taking deep breaths and taking the pain, but overall I think it helped a lot. Yes, so then there was this midwife which told me how I should push, and my husband was there to actually see the whole process. So he actually saw the baby coming out and everything there. And of course, after that, until date, he always tells me that, oh my god, it's such a brave thing to do. And I would suggest all the men, if it's possible, you should, you know you should be there with your wife during that experience, because you are going to have immense respect. Be it a cesarean or a natural delivery, you would have immense respect for what a woman goes through during that process. So yeah, my husband was there, and then Ved was born right there. Fun fact, just a day before, we had actually finalized Ved's name. So we decided that, okay, we want to name the baby Ved. And he was just waiting for that, I guess, because the next day he came. So after the delivery, they told me I had a tear and they had to make stitches. Now you would think, oh, delivery is over and the pain is over, but that was not true. It took 45 minutes for my stitches. Oh my god, 45 minutes. So, and this was the time when obviously I was like, I can't take pain anymore. Can I try the laughing gas now? And they got me the laughing gas. You have to put it on your face like this, like you have to hold it and then you have to breathe in. And don't worry, you are not laughing. You are just, you feel numb. And I think it was very, very, very useful. I didn't feel a thing. Like I was feeling something is happening, but I didn't feel a thing. It was very good. And as soon as you remove the mask, within 15-20 minutes, the whole effect is gone. So it is very good, I would say. It does not have, at least not that I know, it does not have any side effects. So it was very good. Then after that, the whole stitches long process, they took me to the room upstairs, and fortunately, because we had told them very much in advance, we got a family room as well. And I think this was very useful because during these 3 days when they make you stay at the hospital, they do tell you how to change the diaper, but like once or twice, and then you have to do it yourself. It was always Ashish doing it. And I think I cannot imagine how it would have been if he was not there with me. So it was very, very useful to have the family room, and I would totally suggest you. So as soon as you can, as soon as you enter the hospital and fill out the form, you need to tell them that you want the family room. Okay, now let's come to the hospital food. Now, obviously, after delivering, pasta and bread, and these are not some things that you would want, or at least that I wanted. I really wanted some comfort food, so I wanted my dal chawal. And unfortunately, over here, you do not get any of those comforting meals at all. But fortunately, we had our friends, and they got us home cooked food. And I think that was very, very, very helpful, because my mom was not here and she was supposed to come 2 days after. So yes, and I can also attach some pictures of how the hospital food looked like. It might be good, but I didn't really want to try it. I just wanted to stick to my dal chawal. Looking back, I learned so much about giving birth in Germany. The surprises, the support, the little things no one tells you about. And my biggest advice, choose your hospital carefully. Attend a birth preparation class if possible, and pack your bags early. I mean, really. If you're pregnant or planning to give birth in Germany, let me know what surprised you the most or what you are worried about. And don't forget to subscribe, because in the next video, I will share about the not so talked about trimester, which is the postpartum recovery phase, and everything you need to know, the role of your midwife and life at home with the newborn. So see you in the next video.